from Groundhog's Day. We rolling? All right. All right, everybody, Mike the PT. We're giving you tibia lengthening information. We're within about the 2 to 3 weeks post-operative situation here, okay? So the tibia procedure looks a lot like this. So that procedure is going to affect this part of the leg, okay? So from knee, it actually affects the top of the knee all the way down to the foot and ankle, okay? So the foot and ankle complex has to come towards you and toe away from you, okay? So this is the most important part to rehab during that time period, but also up at the knee as well, okay? So the tibia is going to get the lengthening through this part right here. So we're not worried about a lot what's going on in the hip and the quad and the hamstring this time. However, it's still important to pay attention to it. And so I'll go ahead and add those types of exercises in with the tibia lengthening. But let's go ahead and go over and review the exercises that we start on post-operative, 2 to 3 weeks for the tibial lengthening surgery. All right, so we're on the first exercise for the post-tibial lengthening surgery. This is the rehab for it. So the first exercise is going to be called what we call gas pedals. So we're in May of 2022 and gas prices are sky high, so we can't call these gas pedals anymore. It's just too expensive. So we're going to call them ankle pumps. That's a joke for all the people who are here. You'll learn it soon enough. All right, stretchy band, foot up, elevated up off the table. And you're going to go band over the foot, okay? You're going to pull tight, and you're going to pump the foot, pointing away. And so I give you a little bit of room here. So forward and backwards, okay? This is for this muscle down here. You're going to pump forward and backwards. We're going to try to do that about 20 to 30 times, and you'll do that 3 to 4 times per day. All right, exercise number 2. Sticking with the TheraBand and the foot elevated off the table, you're going to pull your foot towards you, okay? Oops, there's another blooper. All right, so you're just setting the band around your foot and pulling back towards you. You may need someone to help you with this exercise or tie it off so that you can pull your foot back. Work the muscles on the front of the leg and stretch the back. All right, we're on exercise number 3 in the tibial lengthening rehab here. So now we're going to move to a different type of a band. It's a material cord, not so much the stretchy one that we had on before. So with this one, we're going to loop it around, similar like we did before, around the edge of the foot here, okay? So what they're doing is with the leg straight, you're going to pull the toes back to stretch the gastrocnemius muscle, and that's the calf muscle that comes behind your leg and passes past your knee. You have to stretch it in a leg straight position, not in the leg bent. That's a different muscle that you're stretching. When you're on the slant board or doing the other types of stretching, you're going to get the different muscle that sits behind it. It's called the soleus. But this one you're going to pull and hold, and you want to be in this up-sitting position if you can tolerate it, and that will really increase the stretch. You might get a little bit of nerve tensioning as well, but that's to be expected in this procedure. All right, we're on exercise number 4 for the tibial lengthening here. So one thing that I like to implement is a little bit of weight bearing through the legs just to get some tolerance. We're obviously in the precise 2.2 nail for right now, so there is a weight bearing precaution. However, the exercise we're about to do, you're within the weight bearing protocol and the weight bearing precautions, no problem. So just in the laying down position, and it's hard to do this on a soft bed. Some folks have gone off to purchase like a massage table like we use in the clinic. Firmer surface, easy to get on and off on. I don't suggest you get down onto the floor. It's a little difficult to get up from it, especially early on within this 2 to 3 weeks. Now, when you are later on in the progress, it might be a little bit easier, but for right now, firm surface, Bridges, okay, knees bent, and you're just lifting your butt up off the table and down. So pushing through the legs, you can even kind of lift those toes up just a little bit, drive the heels down and go down. If you get a cramping in your hamstring, it's because you're not using the glute muscles. Now this could be common coming out of post-operative. You could either be dehydrated, fatigued, or because of the medication you're on, it could throw off some cramping. If you get the cramps, stop doing the exercise and you can switch to a different type of one where you're just doing what we call a glute set and you're just squeezing the muscles. Squeeze the butt muscles together, clench them, and relax, okay? So that's the low end. The bridge lifting up off the table is the next end, and you should be able to handle that pretty well. If you've just had tibial lengthening surgery, the #1 piece of equipment that you need is this. It's called a slant board, okay? And let me show you why you need this, okay? So how this board works is, open it up and you have a slant. You can go higher or you can go kind of in the lower slot, okay? You put this down on the ground, you sit down and you put your feet on it, and you slide up or you scoot up, okay? Come over this way, let me show you kind of what's happening here. So the toes have to be lifted and the heel has to be down. That's so that you're stretching the heel cord, Achilles, and calf region, okay? And what you do is, you just sit in here, you lean on your knees, you do whatever it takes to get the heels down and the toes up so that you're in here doing this stretch position to try to keep this mobility in this area as your tibia is lengthening. This is a calf or gastroc soleus stretch with the knee bent. We're hitting one part of the muscles that are in the foot that bring it up, okay? So there is a more important muscle that you're gonna do, and I'll show you. When you have your walker, same scenario, because if you're on precise 2.2, you have to unload. You're gonna come on the board and you're gonna go knees straight. Knees straight hits the second muscle that is for the foot and ankle that helps you go up on your toes, but you have to loosen and keep lengthened, okay? So this is the gastrocnemius. When I'm sitting, it's the soleus. So two muscles that you have to stretch out here, okay? So up here, you're still gonna unload. You're gonna do a slight lean forward, and you're gonna stretch the back of those calves. You're gonna hold these positions for minutes at a time. It's gonna wear your hands out, but that's okay, that's just part of it. You're gonna build up to about 3 minutes, then to 5 minutes. At some point, you're gonna be up to about 10 minutes of stretching your gastroc and your soleus, okay? This is in order to get that. Well, 60 millimeters, some shoot for 70. I've never met an 80 millimeter, so reach out to me if that's you. Sit it. All right, I want to talk a little bit about gait training, meaning how you walk post-tibial lengthening surgery, okay? What we tend to see happen is, because remember how your foot and ankle, it's getting tight, so your foot tends to drop down, okay? So while you're trying to walk, what happens to a lot of people is they stay back. They kind of use the walker and they're set back because it's hard to move forward, okay? So early on when you're up out of bed, walking, and trying to get to where you're moving to the bathroom or doing your exercises, real important, I want you to make sure that you're not sitting back trying to walk like this, okay? You want to try to stay forward in the walker, okay? Arms are taking the weight off and my feet are forward, and you take steps. And you can step 2, that's fine. But you just want to make sure you're stepping, but you want to go belly button forward when you're here, okay? So one thing I want to just put emphasis on when you're doing the tibial lengthening surgery is, we've talked a little bit about it, but this is a slant board and we can make the adjustments, bring it down just a little bit. It's vitally important that your foot, your toes are coming up, okay? And you're stretching the back of your legs, okay? Straight leg, leaning forward on the walker or against something, and you can stay here for multiple minutes. It doesn't matter how long. What I'm talking about, the other muscle that's behind your leg, the gastroc muscle crosses your knee. The soleus muscle does not. It stays below. So if you were to bend your knee and do a stretch of this sort, you're stretching a different muscle and it's easier, okay? The docs want you to make sure your legs are straight and your feet are coming back towards you. So this is going to be the majority of the position you're going to be in to help stretch at home. I suggest you invest in this slant board. You can use a step stair or a thick book. Back in the old days, we used phone books, but that's outdated. So good luck to you.